Welcome, everyone. Thank you for joining our Clinical View series on thriving as a flexible health system. I'm Matt Smith with GE Healthcare, and I'm happy to be hosting this panel discussion. Our previous session focused on the shift toward the acuity-adaptable model of care, what it is, how it supports the movement toward flexibility, and why some hospitals are considering and even adopting it. This session will focus on how hospitals can support acuity-adaptable care models, including the technologies, workflows, and cultural changes to consider. But before we get into it, let's start with a brief round of introductions. Can each of you please start by sharing a little bit about your background and current position? We'll start with Brandon and continue with Corey and then Faye.
All right, thanks. Brandon Henak. I'm the executive director for the monitoring solutions business for marketing. I get a chance to work between our product management teams and customers, like many of those that are listening today, to make sure that we fully understand in depth the needs that you have for monitoring solutions in the hospital, and make sure that we translate those into the products that we're releasing every day. So excited to be here, excited to talk a little bit about Acuity Adaptable Solutions.
My name's Corey Gaarde. I'm a principal with IMEG. I oversee our healthcare information technology advisory services practice. By doing that, I strategically lead a team of healthcare IT professionals advancing the role of technology in the future of healthcare facility design. In this role, I help ensure kind of a comprehensive, collaborative, and connected care technology considerations focused on a patient and caregiver experience at the earliest stages of the engineering design process and subsequently throughout.
I'm Faye Aebly. I'm the Clinical Development Manager for GE Healthcare Patient Monitoring. I'm also a CVICU staff nurse at St. Luke's Medical Center in Milwaukee, Wisconsin. I am the clinical voice into our new product development, ensuring that our products meet clinical expectation and are integrated seamlessly into clinical workflow.
Great, thanks, Faye. Brandon, let's kick things off with you. During our previous session, we spoke about how the key to successfully managing a patient through the continuum of acuity levels means being able to detect changing needs. What are innovative hospitals doing that really allow their clinicians to successfully detect and respond to changing care needs?
Great question, Matt. First off, the leading institutions that we talk to are looking at first, how do we detect deterioration or changes in patient status as quickly as possible so that you can adapt care, right? The second is making sure that the equipment and capabilities that they have are adaptable to those patient needs throughout the continuum of care. And then finally, they're looking at unique ways to provide clinical decision support to those clinicians to make sure that throughout that care, they have standardized protocols to help drive better care and better outcomes. For the first step, understanding what's happening with patients as early as possible, many institutions are saying we need continuous monitoring of patient status throughout the patient's stay. And what this starts to look like in some institutions is using things like telemetry or other mobile monitoring for patients, even in lower acuity spaces. Now, there's a lot of ways that you can do this, but many institutions are saying, how do we better monitor those patients and use the right capabilities, monitoring capabilities throughout the patient's stay, and then detect that deterioration and adjust as we go. Now, a key piece that institutions are looking for is, can we use a single unified monitoring solution throughout that care continuum so that you don't have the challenge of switching a patient between monitors, between capabilities, but really you can just add and remove capabilities as that patient status changes. So early monitoring to make sure you understand when a patient's status changes so that you can adapt care, then using flexible capabilities that are standardized throughout the institution, but also flexible to those patient needs. And then finally, with clinical decision support, they're looking at ways to bring all of the data together in one place and interpret it with algorithms to say, do we have established protocols? And then are we flexing those protocols as the patient's needs change? Especially in acuity adaptable spaces, this is important because the nursing population stays the same, but that status and acuity has changed. So giving that clinical decision support gives that an additional capability to the care team that is trying to provide care as that status changes. So this is really what they're looking at: standardization, early monitoring, and clinical decision support.
Great. Thanks, Brandon. So Corey, Brandon just mentioned various monitoring and clinical decision support tools that help support acuity adaptable clinical workflows. From your experience, what other technological considerations should hospitals be aware of that might not be top of mind?
Yeah, I think that the one key thing, and Brandon kind of touched on, is don't underestimate the focus around the smart patient, caregiver, and really hospital experience. We can no longer just focus on just the room, but treating the entire healthcare facility as a living and breathing entity, just as the patients and care providers that operate them. The broader use of patient entertainment education, digital care board and room signage, proliferation of telemedicine, general video in the room presence from the patient use and clinical use, and the use of advanced artificial intelligence for much more proactive versus reactive care models. We're seeing a much bigger growth and interest as it relates to command centers and virtual monitoring. That continues to be in areas of focus in different size and scales. Again, not just clinical, but also the operations, environmental, and security. Interesting, though, we had an experience recently with a large academic medical center here in the Midwest where we designed a whole floor on a wing for full exhaust well prior to COVID. So there goes again to show you it's not new to the industry, but when COVID came up, they did not use it. They did not use it, and frankly, it was because the nurse and general operations didn't align with the building systems. So they did not want to gown up and spend all day in one wing, and then prefer grounding up and downing off for each other areas. The design and supporting technologies, honestly, is the easy part. It ultimately goes back to the operations as the biggest obstacle, but staff preferences are critical.
So Faye, we've talked about some of the technologies and capabilities that need to be in place to effectively deploy an acuity adaptable care model. What about culture? What does a hospital need to consider to help ensure alignment and adoption?
Yeah, this is a really sensitive topic, as alluded to earlier. Clinicians have been asked to adapt a lot lately with the COVID pandemic and changing in the workforce. We saw a lot of people leaving the bedside for retirement after COVID was done. So while acuity adaptable care has the possibility to change how healthcare is really delivered globally, and for it to realize the many benefits it provides for patient caregivers and organizations, it really requires hospitals and clinicians to be open to change and to have a plan which will enable them to sustain this type of long-term change. As I mentioned earlier, clinicians need to accept working in a really flexible, ever-changing environment that acuity adaptable care models bring. This type of change can be really difficult and uncomfortable for some people. So there really needs to be a thought out commitment to break down the barriers to the traditional types of care that have been delivered, and to have people really envision how acuity adaptable care can really succeed and really benefit everybody involved. Change needs to be purposeful and well communicated. It has to be part of the hospital culture. Clinicians need to accept if that the benefits, if they want to see those benefits, it's going to take some time, but they have to change their practice. And nurses like to be in control, which this may be an uncomfortable place for them initially. Clinicians and physicians, nurses need to be involved in the planning and the communication of the process and the benefits right from the beginning to be successful. If they're not, I think that this type of a care model could actually struggle. Many initiatives have failed because clinicians have not been included in the development of the process. So while we recognize there's a lot of benefits, it really is a commitment with everybody involved that this is what they want to do and the benefits that they want to achieve for the patient, clinician, and the organization.
Great, thanks, Faye. So Corey, you and your team at IMEG work closely not just with hospitals, but with various professional societies that have explored the concept of acuity adaptable care for several years now. So looking forward, what broader changes do you anticipate as far as the adoption of these care models in the coming years?
I think you're going to see a shift in change. The Facility Guidelines Institute, has already been incorporating a lot of different changes as it relates to code and technology evolutions. I mean, we're trying to be in the leading edges of that. I sit on the Environmental Standards Council for the Center for Healthcare Design, and this is front of mind. So I think that we as an industry and as a design firms recognize that this stuff needs to be incorporated now to obviously prepare for the not the what happens, it's just when it happens. I think that measuring and understanding the KPIs is also going to be critical to this. Obviously, quality outcomes are going to be continuously changing. Metrics back to the CMS. HCAPS is definitely playing a much more broader role. Reimbursement. And understanding just what the pulse of the staff is, their engagements, the multipliers. Are they trained to do this? It's interesting. We've had some discussions early on. Is that are we teaching physicians and care and nurses staff, early on in colleges now to support these different models? I think that some things that kind of separate the successful from a less successful one. Extensive upfront and comprehensive planning from all stakeholders. That is paramount. This cannot be designed in a silo. So we need to be cognizant of that as we design new facilities, that having everybody a seat at the table is going to be absolutely critically important. And all the way throughout the design process and training, continuous monitoring from day one is going to be the keys to success. And again, having that 100% staff engagements. Are we starting to see a shift from acuity adaptable floors to hospitals, et cetera? The trend continues to develop for sure. But I think as we've talked about, as to what size and scale, and does it make sense for all areas? But ultimately, again, it goes back to that staffing model. We can design it and really develop these things from a cost-effective perspective. But if we don't have the staff, the operations, the supply chains, the pharmacy distribution and staff to really support some of these things, the design and the stuff becomes moot. So, we need to be making sure that we're really focusing on, the staff, adoptions and training capabilities that need to be, incorporated as part of this.
Great. Thanks, Corey. So Brandon, I'll give you the last word today. Similar question for you. What do you see as the commonality among hospitals that you work with that are expanding their approach to adaptable acuity?
Well, I think Faye and Corey covered it really well. The ones that are expanding it have realized the benefits, right? The many benefits that Faye went through, the impact and improvement on care workflows. And they have figured out the regulatory and staffing requirements, right? It's a different model. It's a different way to staff, and it's a different way to care for patients. So they've gone through that process to understand the context of care in their environment, in their state, in their area, to make sure that they're able to fit the staffing needs that they've got to the needs of the patient, and then support those changes in acuity. They've gone through robust change management processes, right? I think Corey mentioned that both the metrics to be able to track it, good change management approaches, that really can help drive the change as a whole, because it is a significant change in the care process. And then I would say all of the parties have been involved throughout the process of both establishing that they're going to move to the model, selecting and purchasing equipment to support that model that's flexible, that's standardized, easy to use, and that the clinicians love to use and interact with. And then all parties are involved in measuring the results, right? Making sure that they're on board, they understand the positive impact for patients. And if we can get around the fact that it's really about the patient, right? That it's the focus on that patient and changing the environment for their needs, I think everybody's on the same page. If we can provide better care for patients, that's ultimately the end goal. So once they've managed those issues, understood the regulatory and staffing, established good change management processes, and then built out both the equipment, the environment, and the institution itself around it, there's a ton of benefit that those institutions are seeing. And that's why we're seeing such a big move towards this care model.
Great. Thanks, Brandon. Nicely put. So thanks to all of our panelists for sharing your observations and insights. I think it's clear that transitioning to an acuity adaptable model of care has many benefits, but it's not without its challenges. So thank you all for sharing your thoughts and suggestions for overcoming some of the barriers. And thanks to our viewers for joining us. We look forward to having you join us at future events.